Question 1. A client with a history of heart failure is admitted with acute decompensated heart failure. The nurse notes the client is orthopneic and has crackles bilaterally. Which prescribed medication should the nurse anticipate administering first? A. Lisinopril. B. Furosemide. C. Digoxin. D. Metoprolol. Answer: B. Furosemide. This question tests the immediate prioritization of care for a client experiencing acute heart failure exacerbation, indicated by orthopneic, difficulty breathing when lying flat, and crackles, fluid in the lungs. The key is to address the acute respiratory distress and fluid overload promptly. Furosemide, a loop diuretic, will help excrete excess fluid, thereby reducing pulmonary congestion and improving breathing. For example, administering furosemide quickly helps dry out the lungs, allowing the client to breathe more easily. Always remember that managing ABCs, airway, breathing, circulation, is the top priority in acute situations, and diuretics directly address the breathing compromise caused by fluid overload in heart failure. Question 2. The nurse is caring for a client with a new prescription for continuous intravenous infusion of heparin. Which laboratory value is most critical for the nurse to monitor to ensure therapeutic effect and client safety? A. Prothrombin time, PT. B. Activated partial thromboplastin time, APTT. C. International Normalized Ratio, INR. D. Platelet count. Answer: B. Activated partial thromboplastin time, APTT. This question evaluates understanding of medication monitoring, specifically for unfractionated heparin, a common anticoagulant. The critical keyword is continuous intravenous infusion of heparin, which requires close monitoring of its anticoagulant effect. The activated partial thromboplastin time, APTT, is the primary laboratory test used to monitor the therapeutic effectiveness of continuous intravenous heparin and guide dose adjustments. For example, an APTT that is too low indicates the heparin dose might be insufficient, while one that is too high suggests a risk of bleeding. Remember that the APTT is your go-to lab for managing intravenous heparin, ensuring safety and efficacy. Question 3. A client with acute pancreatitis develops severe abdominal pain, nausea, and vomiting. The nurse notes a Cullen's sign and Turner's sign during the assessment. What is the most important nursing intervention at this time? A. Administer prescribed antiemetic medication. B. Prepare the client for immediate surgical intervention. C. Monitor for signs of hypovolemic shock. D. Encourage the client to ambulate frequently. Answer: C. Monitor for signs of hypovolemic shock. This question tests the nurse's ability to recognize critical complications of acute pancreatitis and prioritize interventions. Cullen's sign, periumbilical ecchymosis, and Turner's sign, flank ecchymosis, indicate retroperitoneal bleeding, a severe and life-threatening complication of acute pancreatitis. This bleeding can rapidly lead to hypovolemic shock, a state of low blood volume. Therefore, the most important nursing intervention is to continuously monitor for signs of hypovolemic shock, such as hypotension, tachycardia, and decreased urine output, to intervene rapidly. While antiemetics are helpful, addressing potential shock is a higher priority because it directly impacts circulation and organ perfusion. Always remember that bleeding can quickly lead to shock, and recognizing these signs warrants immediate monitoring for circulatory compromise. Question 4. The nurse is preparing to administer phenytoin intravenously to a client experiencing a tonic-clonic seizure. Which action by the nurse is appropriate? A. Administer the medication rapidly, over 30 seconds. B. Dilute the medication with dextrose 5% in water, D5W, for infusion. C. Monitor the client closely for bradycardia and hypotension during administration. D. Administer the medication through an intramuscular injection if access is difficult. Answer: C. Monitor the client closely for bradycardia and hypotension during administration. This question assesses the nurse's knowledge of safe medication administration, specifically for intravenous phenytoin, an anticonvulsant. Phenytoin should be administered slowly, typically no faster than 50 mg per minute, to prevent adverse cardiovascular effects. Rapid administration can cause severe bradycardia and hypotension, which are critical to monitor during the infusion. For instance, injecting too quickly could drop the client's blood pressure dangerously low. Never dilute phenytoin with D5W because it precipitates, and never give it intramuscularly as it causes tissue damage. Only use normal saline for dilution. Always remember to administer phenytoin slowly and monitor for cardiac side effects to ensure client safety. Question 5. A 72-year-old client with pneumonia is admitted to the hospital. The nurse notes new onset confusion and restlessness. The client's oxygen saturation is 94% on 2 liters per minute nasal cannula, and vital signs are stable. What is the nurse's priority action? A. Administer a prescribed sedative to calm the client. B. Reorient the client to time, place, and person. C. Assess the client's pain level. D. Obtain arterial blood gases, ABGs. Answer: D. Obtain arterial blood gases, ABGs. This question tests the nurse's critical thinking and prioritization in an elderly client with pneumonia, where new-onset confusion and restlessness can be subtle signs of hypoxemia or hypercapnia, even with a seemingly adequate oxygen saturation. While sedatives are inappropriate, reorientation and pain assessment are important. The priority is to rule out a physiological cause impacting brain function. Obtaining arterial blood gases, ABGs, provides a more accurate assessment of oxygenation and ventilation, POW2, POCO2, pH, which is crucial for determining if the confusion is due to respiratory compromise. For example, a client might have a normal SpO2 but retain carbon dioxide, leading to confusion. Always remember that a change in mental status in an older adult, especially with respiratory illness, warrants a thorough assessment of oxygenation and ventilation first. Question 6. A client with a new colostomy expresses fear and refusal to look at the stoma. The client states, "I can't believe this has happened to me, my life is over." What is the most therapeutic nursing response? A. Many people adjust to colostomies over time, you will too. B. It sounds like you are feeling overwhelmed right now. C. Let's schedule a visit with an ostomy support group. D. Tell me more about why you feel your life is over. Answer: D. Tell me more about why you feel your life is over. This question assesses therapeutic communication skills, specifically active listening and exploring the client's feelings. The client is expressing significant emotional distress and a sense of loss related to the colostomy. The most therapeutic response is to invite the client to elaborate on their feelings, using an open-ended question like, "Tell me more about why you feel your life is over." This demonstrates empathy and encourages the client to express their true concerns, allowing the nurse to understand their perception and plan appropriate support. Telling them many people adjust is dismissive, and suggesting a support group or scheduling a visit is premature without fully understanding their current feelings. Remember that therapeutic communication involves actively listening and encouraging the client to express their thoughts and feelings before offering solutions or reassurance. Question 7. The nurse is caring for a client who is receiving total parenteral nutrition, TPN, at home. The client reports feeling shaky, dizzy, and diaphoretic. What is the nurse's immediate action? A. Administer a bolus of the prescribed TPN. B. Check the client's blood glucose level. C. Decrease the rate of the TPN infusion. D. Encourage the client to drink a full glass of orange juice. Answer: B. Check the client's blood glucose level. This question tests the nurse's ability to recognize signs of hypoglycemia and prioritize intervention for a client on TPN. The symptoms reported, shaky, dizzy, diaphoretic, are classic signs of hypoglycemia, low blood sugar, which can occur if the TPN infusion is interrupted or stopped suddenly, or if the client's glucose metabolism changes. The immediate action is to check the blood glucose level to confirm hypoglycemia. If the client is hypoglycemic, administering orange juice or D50 would be appropriate, but only after confirming the blood glucose level. For example, if the TPN was stopped, the body might still be producing high insulin levels, leading to a rapid drop in blood sugar. Always remember to assess first when a client reports symptoms, especially those indicative of a common TPN complication like hypoglycemia. Question 8. A client with a head injury develops a temperature of 104 degrees Fahrenheit 40 degrees Celsius, severe muscle rigidity, and confusion. The client's medication list includes haloperidol. The nurse suspects neuroleptic malignant syndrome, NMS. What is the priority nursing intervention? A. Administer a prescribed antipyretic immediately. B. Prepare to administer a muscle relaxant such as dantrolene. C. Implement seizure precautions and maintain airway. D. Discontinue the haloperidol and notify the healthcare provider. Answer: D. Discontinue the haloperidol and notify the healthcare provider. This question requires the nurse to recognize the critical signs of neuroleptic malignant syndrome, NMS, a life-threatening idiosyncratic reaction to antipsychotic medications like haloperidol. The key signs are high fever, severe muscle rigidity, and altered mental status. The priority intervention in NMS is to immediately discontinue the causative agent, in this case, haloperidol, and then notify the healthcare provider. While managing symptoms like fever and rigidity is important, removing the trigger is paramount to halt the progression of the syndrome. For example, continuing the medication could worsen the client's condition, potentially leading to renal failure or respiratory failure. Always remember that stopping the offending medication is the first and most critical step in managing medication-induced syndromes like NMS. Question 9. A nurse is assessing a 4-day-old newborn. Which finding requires immediate intervention? A. Yellowish tint to the skin on the face. B. White, cheesy substance in the skin folds. C. A single crease across the palm of the hand. D. Respirations of 65 breaths per minute with nasal flaring. Answer: D. Respirations of 65 breaths per minute with nasal flaring. This question tests the nurse's knowledge of normal versus abnormal newborn assessment findings and the ability to prioritize. A respiratory rate of 65 breaths per minute, especially coupled with nasal flaring, a sign of respiratory distress, is indicative of tachypnea and increased work of breathing in a newborn, which requires immediate intervention. While a yellowish tint on the face might indicate physiological jaundice, and a single palmar crease might suggest Down syndrome, requiring further evaluation but not immediate intervention, respiratory distress is an acute, life-threatening concern. The white, cheesy substance is vernix caseosa, a normal finding. Always prioritize breathing difficulties in a newborn as they can quickly escalate into respiratory failure. Question 10. A client is admitted with diabetic ketoacidosis, DKA. The nurse anticipates which primary intravenous fluid prescription initially? A. 0.45% sodium chloride, half normal saline. B. Dextrose 5% in water, D5W. C. 0.9% sodium chloride, normal saline. D. Lactated Ringer's solution. Answer: C. 0.9% sodium chloride, normal saline. This question assesses knowledge of initial fluid resuscitation for diabetic ketoacidosis, DKA. Clients in DKA are severely dehydrated due to osmotic diuresis caused by hyperglycemia. The primary initial goal is rapid rehydration. 0.9% sodium chloride, normal saline, is the isotonic solution of choice for initial fluid replacement in DKA because it rapidly restores intravascular volume without shifting fluids into cells, which could worsen cerebral edema. For example, using a hypotonic solution initially could cause water to shift into the brain, leading to dangerous swelling. Remember that normal saline is the preferred initial fluid to correct the significant dehydration seen in DKA. Question 11. A client with a new tracheostomy is experiencing difficulty breathing, and the nurse notes copious, thick secretions and an audible gurgling sound. What is the nurse's priority action? A. Increase oxygen flow rate. B. Administer a nebulizer treatment. C. Perform tracheostomy suctioning. D. Notify the healthcare provider immediately. Answer: C. Perform tracheostomy suctioning. This question assesses the nurse's immediate response to a client with a new tracheostomy experiencing respiratory distress due to secretions. The keywords difficulty breathing, copious, thick secretions, and audible gurgling all indicate airway obstruction caused by retained secretions. The priority action is to clear the airway through tracheostomy suctioning. Increasing oxygen or administering a nebulizer might be subsequent actions, but clearing the immediate obstruction is paramount. For example, if a client is drowning in their own secretions, suctioning them out is the only way to open their airway. Always remember that maintaining a patent, open, airway is the absolute top priority in any respiratory emergency, and suctioning directly addresses secretion-related obstruction. Question 12. The nurse is caring for a client with a history of alcohol use disorder who is experiencing acute alcohol withdrawal. The client is restless, diaphoretic, and reports seeing bugs crawling on the walls. Which medication should the nurse anticipate administering first? A. Lorazepam. B. Haloperidol. C. Naltrexone. D. Thiamine. Answer: A. Lorazepam. This question tests the nurse's knowledge of managing acute alcohol withdrawal, specifically recognizing the signs of delirium tremens, DTs, which include visual hallucinations and autonomic hyperactivity. Benzodiazepines, such as lorazepam, are the first-line treatment for alcohol withdrawal symptoms and prevention of seizures and delirium tremens, as they work by calming the central nervous system. While thiamine is crucial for preventing Wernicke-Korsakoff syndrome, and haloperidol might be used for severe agitation after benzodiazepines are initiated, the immediate priority is to suppress the overactive central nervous system to prevent complications. For example, administering lorazepam helps reduce agitation, tremors, and hallucinations, making the client safer and more comfortable. Always remember that benzodiazepines are the mainstay of treatment for acute alcohol withdrawal to manage the severe symptoms and prevent seizures. Question 13. A client post-appendectomy reports abdominal pain rated 8 out of 10, 30 minutes after receiving intravenous hydromorphone. The nurse assesses the client and finds a distended, firm abdomen and absence of bowel sounds. What is the nurse's priority action? A. Administer an additional dose of hydromorphone. B. Document the findings and continue to monitor. C. Place a nasogastric tube to decompress the stomach. D. Notify the healthcare provider immediately. Answer: D. Notify the healthcare provider immediately. This question assesses the nurse's ability to recognize a potential postoperative complication that requires immediate medical attention. While pain is present, the new findings of a distended, firm abdomen and absent bowel sounds after an appendectomy, especially after receiving pain medication, are highly concerning for a serious complication like peritonitis or a bowel obstruction, not just inadequate pain control. Notifying the healthcare provider immediately is the priority to allow for prompt diagnosis and intervention. Administering more pain medication or simply documenting would delay critical care. For example, if a bowel obstruction is present, immediate medical or surgical intervention is needed to prevent further damage. Always remember that new, significant assessment findings that deviate from expected postoperative recovery, especially those indicating complications, require urgent communication with the healthcare provider. Question 14. The nurse is providing discharge teaching to a client with newly diagnosed type 2 diabetes regarding proper foot care. Which statement by the client indicates a need for further teaching? A. I should inspect my feet daily for any cuts or sores. B. I can walk barefoot around the house to let my feet breathe. C. I will always wear clean, dry socks and well-fitting shoes. D. I should trim my toenails straight across after bathing. Answer: B. I can walk barefoot around the house to let my feet breathe. This question tests the nurse's knowledge of essential foot care for diabetic clients and the ability to identify an incorrect understanding. Clients with diabetes are at high risk for peripheral neuropathy and poor circulation, making them prone to injuries and infections that can lead to severe complications, including amputation. Walking barefoot, even at home, increases the risk of cuts, scrapes, or punctures that the client might not feel due to neuropathy, thus indicating a need for further teaching. All other options are correct and essential components of diabetic foot care. For example, a small splinter picked up while walking barefoot could go unnoticed and develop into a serious infection. Always teach diabetic clients to protect their feet at all times by wearing appropriate footwear to prevent injury and infection. Question 15. A client with chronic kidney disease, CKD, receiving hemodialysis has a new order for erythropoietin alpha. The nurse understands this medication is prescribed to treat which condition? A. Hypertension. B. Anemia. C. Hyperkalemia. D. Bone disease. Answer: B. Anemia. This question tests the nurse's understanding of pharmacological management for clients with chronic kidney disease, CKD. Erythropoietin alpha is a synthetic form of erythropoietin, a hormone normally produced by the kidneys that stimulates red blood cell production. In CKD, damaged kidneys produce insufficient erythropoietin, leading to chronic anemia. Therefore, erythropoietin alpha is prescribed to treat the anemia associated with CKD. For example, without this medication, clients with CKD would experience significant fatigue and weakness due to low red blood cell counts. Remember that erythropoietin helps the body make more red blood cells, directly addressing the common anemia seen in kidney disease. Question 16. A client in labor is receiving oxytocin for augmentation. The nurse notes the fetal heart rate decelerates to 90 bpm after the peak of a contraction and remains below 100 bpm for 45 seconds before returning to baseline. What is the nurse's priority action? A. Increase the oxytocin infusion rate. B. Reposition the client to her left side. C. Prepare for an immediate vaginal delivery. D. Discontinue the oxytocin infusion. Answer: D. Discontinue the oxytocin infusion. This question assesses the nurse's ability to identify and respond to non-reassuring fetal heart rate patterns, specifically late decelerations, which indicate uteroplacental insufficiency. The description of the deceleration occurring after the peak of a contraction and prolonged below 100 bpm is characteristic of a late deceleration. Oxytocin causes uterine contractions, which can exacerbate uteroplacental insufficiency. Therefore, the priority is to discontinue the oxytocin infusion to reduce uterine activity and improve placental blood flow. Repositioning the client and administering oxygen might follow, but stopping the causative agent is paramount. For example, continuing oxytocin would further compromise oxygen delivery to the fetus. Always remember that late decelerations are a sign of fetal distress, and stopping oxytocin is the most immediate way to alleviate the stressor. Question 17. The nurse is caring for a client with a history of intravenous drug use who presents with fever, chills, and a new heart murmur. The nurse suspects infective endocarditis. Which diagnostic test should the nurse anticipate as the priority? A. Electrocardiogram, ECG. B. Echocardiogram. C. Blood cultures. D. Chest X-ray. Answer: C. Blood cultures. This question tests the nurse's understanding of the diagnostic workup for infective endocarditis, particularly in a client with risk factors like drug use. Infective endocarditis is an infection of the heart's inner lining or valves, often caused by bacteria entering the bloodstream. Fever and a new heart murmur are key signs. The priority diagnostic test is blood cultures to identify the causative microorganism, which is essential for guiding antibiotic treatment. While an echocardiogram confirms vegetation on the valves, identifying the specific pathogen is crucial for effective therapy. For example, knowing if it's Staphylococcus aureus or another bacteria determines which antibiotic will be most effective. Always prioritize identifying the pathogen in suspected infections like endocarditis to ensure targeted and effective treatment. Question 18. A client is prescribed phenelzyme, Nardil, a monoamine oxidase inhibitor, MAOI. Which food item, if consumed by the client, indicates a need for further dietary teaching? A. Fresh fruit salad. B. Grilled chicken breast. C. Aged cheddar cheese. D. Steamed vegetables. Answer: C. Aged cheddar cheese. This question assesses the nurse's knowledge of critical dietary restrictions for clients taking monoamine oxidase inhibitors, MAOIs, like phenelzyme. MAOIs interact dangerously with tyramine-rich foods, which can lead to a hypertensive crisis, a sudden, severe increase in blood pressure. Aged cheeses, along with cured meats, fermented products, and certain alcoholic beverages, are high in tyramine. Consuming aged cheddar cheese indicates a need for further teaching. For example, eating aged cheese while on phenelzyme could cause a life-threatening headache, palpitations, and dangerously high blood pressure. Always emphasize strict adherence to the low tyramine diet for clients on MAOIs to prevent a hypertensive crisis. Question 19. The nurse is caring for a client with a new peripherally inserted central catheter, PICC, line. The client suddenly develops shortness of breath, pleuritic chest pain, and tachycardia. What is the nurse's initial action? A. Obtain a 12-lead electrocardiogram, ECG. B. Place the client in a Trendelenburg position. C. Clamp the PICC line. D. Administer a prescribed anxiolytic. Answer: C. Clamp the PICC line. This question tests the nurse's immediate response to a suspected air embolism, a serious complication of central venous catheter insertion or manipulation. The symptoms of sudden shortness of breath, pleuritic chest pain, and tachycardia are classic indicators of an air embolism. The initial and most critical action is to clamp the PICC line to prevent further air from entering the circulation. This is followed by placing the client in Trendelenburg on the left side to trap air in the right ventricle, and then notifying the healthcare provider. For example, failing to clamp the line could allow more air to enter, potentially causing cardiac arrest. Always remember to immediately clamp any central venous line when an air embolism is suspected to prevent further air entry. Question 20. A client with a spinal cord injury at the T6 level reports a pounding headache, blurred vision, and profuse sweating above the injury site. The nurse notes a blood pressure of 190/100 mmHg. What is the nurse's immediate priority action? A. Administer a prescribed antihypertensive medication. B. Elevate the head of the bed to 90 degrees. C. Assess for a full bladder or bowel impaction. D. Call for assistance from the rapid response team. Answer: C. Assess for a full bladder or bowel impaction. This question assesses the nurse's ability to recognize and manage autonomic dysreflexia, a life-threatening emergency in clients with spinal cord injuries at or above T6. The symptoms of severe hypertension, pounding headache, blurred vision, and diaphoresis above the injury are hallmark signs. Autonomic dysreflexia is typically triggered by noxious stimuli below the level of injury, most commonly a distended bladder or bowel impaction. Therefore, the immediate priority is to identify and remove the stimulus by assessing for bladder distension, example kinked catheter, full bladder, or bowel impaction. For example, simply raising the head of the bed and administering medication without addressing the cause won't resolve the crisis. Always remember to look for and alleviate the underlying cause of autonomic dysreflexia first, as it's often a quickly reversible trigger. Question 21. The nurse is caring for a client with AC, difficile infection. Which action is most critical for preventing the spread of infection? A. Wearing a surgical mask during client care. B. Placing the client in a negative pressure isolation room. C. Performing hand hygiene with an alcohol-based hand rub. D. Washing hands with soap and water after client contact. Answer: D. Washing hands with soap and water after client contact. This question tests understanding of infection control practices, specifically for Clostridium difficile, C. difficile, a spore-forming bacterium. While standard precautions are always important, alcohol-based hand rubs are ineffective against C. difficile spores. The most critical action to prevent C. difficile transmission is thorough handwashing with soap and water, as it physically removes the spores. For example, if a nurse uses only hand sanitizer after caring for a C. difficile client, the spores remain on the hands and can spread the infection. Always prioritize washing hands with soap and water for C. difficile and spore-forming organisms to effectively break the chain of infection. Question 22. A client with chronic obstructive pulmonary disease, COPD, on home oxygen via nasal cannula at 2 liters per minute reports increasing shortness of breath and states, "I just can't catch my breath." The nurse assesses the client and finds respirations of 28 breaths/min and an oxygen saturation of 88%. What is the nurse's best initial action? A. Increase the oxygen flow rate to 4 liters per minute. B. Administer a prescribed bronchodilator. C. Encourage pursed lip breathing. D. Prepare for endotracheal intubation. Answer: C. Encourage pursed lip breathing. This question tests the nurse's understanding of managing acute dyspnea in a client with COPD. While an SpO2 of 88% is low, increasing oxygen significantly can suppress the hypoxic drive in some COPD clients. The best initial action to help a conscious, breathing COPD client with increased shortness of breath is to encourage pursed lip breathing. This technique helps prolong exhalation, reduce air trapping, and improve ventilation, providing immediate relief. For example, pursed lip breathing helps expel more stale air, making room for fresh air. Administering bronchodilators is important, but breathing techniques offer immediate, non-pharmacological support. Always try non-invasive interventions like pursed lip breathing first for clients experiencing acute dyspnea related to COPD. Question 23. A client is admitted to the emergency department after a motor vehicle collision with suspected internal bleeding. The nurse assesses a weak, thready pulse, cool and clammy skin, and hypotension. The client is restless and confused. What is the nurse's priority intervention? A. Administer intravenous pain medication. B. Prepare the client for immediate surgery. C. Initiate 2 large-bore intravenous lines for fluid resuscitation. D. Place the client in a reverse Trendelenburg position. Answer: C. Initiate 2 large-bore intravenous lines for fluid resuscitation. This question requires recognition of the signs of hypovolemic shock, weak, thready pulse, cool/clammy skin, hypotension, restlessness, confusion, and the immediate priority intervention. Suspected internal bleeding puts the client at risk for severe blood volume loss. The priority is to rapidly restore circulating volume by initiating 2 large-bore intravenous lines for aggressive fluid resuscitation, example normal saline or lactated ringers, and potential blood product administration. For example, without rapid fluid replacement, the client's vital organs will be deprived of oxygen. While preparing for surgery is a subsequent action, stabilizing the client hemodynamically is the immediate nursing priority. Always prioritize establishing 4 access for fluid resuscitation in clients suspected of hypovolemic shock. Question 24. The nurse is caring for a client who is post-operative day 1 following a total hip arthroplasty. The client reports severe pain in the affected hip. Which non-pharmacological intervention is most appropriate for the nurse to implement first? A. Provide a back rub. B. Reposition the client carefully. C. Apply a cold pack to the surgical site. D. Offer distraction with television. Answer: B. Reposition the client carefully. This question tests the nurse's understanding of postoperative care and pain management for a total hip arthroplasty, specifically prioritizing non-pharmacological interventions. After hip surgery, proper positioning is crucial to prevent dislocation and can significantly alleviate pain by ensuring the hip is in alignment and pressure points are relieved. Repositioning the client carefully is often the most direct and effective initial non-pharmacological intervention for postoperative hip pain. For example, a slight shift in position can relieve pressure on the surgical site or surrounding muscles. While other options like cold packs or distraction can be helpful, ensuring optimal alignment through careful repositioning addresses a direct mechanical source of pain. Always prioritize careful positioning to maintain alignment and reduce discomfort in clients post-hip surgery. Question 25. A client with a history of generalized tonic-clonic seizures is admitted. The nurse observes the client suddenly become unresponsive, stiffen, and then experience rhythmic jerking of all extremities. What is the nurse's immediate priority action? A. Insert a padded tongue blade into the client's mouth. B. Restrain the client's extremities to prevent injury. C. Protect the client's head and ensure a patent airway. D. Administer a rapid-acting anticonvulsant intravenously. Answer: C. Protect the client's head and ensure a patent airway. This question assesses the nurse's immediate priority actions during a generalized tonic-clonic seizure. The primary goal is to protect the client from injury and maintain a patent airway. Protecting the head by placing something soft underneath it and moving furniture away prevents trauma, while positioning the client on their side ensures the airway remains open and prevents aspiration of secretions. Inserting a tongue blade or restraining extremities is contraindicated as it can cause injury. Administering medication is typically a physician's order and happens after initial safety measures. For example, if a client hits their head during a seizure, it could lead to a secondary head injury. Always prioritize client safety and airway management during a seizure by protecting the head and positioning the client to prevent aspiration.